Hi, everyone. Welcome to episode 28 of the How to Become a Doctor video podcast. This podcast is run by the LSU Phase Office, which is Pre-Health Advising, Support, and Education. My name is Matt Duras. I'm one of the pre-health advisors here at LSU, and I'm going to pass it off to our director next.
Yeah, hi, everybody. Thanks for watching. I'm Robbie Bowen. I'm the director of pre-health programs in the College of Science here at LSU. And so we try to make this informative and try to answer some questions that you as a pre-med student, wherever you are in your stage of getting to med school, can have a source of information. And so today we have a guest with us who's coming from the medical school perspective and just admissions and recruitment. Our guest is Caleb Marsh. Caleb is at the Thomas Frist College of Medicine, which is at Belmont University in Nashville, Tennessee. Caleb's role there is director of pathway programs and recruitment for the medical school, which is one of the newest medical schools in our region. But Caleb has a long history of experience in the health professions from the advising perspective, from post-bac programs, med school. So he's a good source of information. So Caleb, thank you so much for joining us today. We appreciate your time.
Hey, thank you. I really appreciate getting an opportunity to be here, talk to you guys, and then also talk to your students just a little bit about the Frist College of Medicine, as well as just, talking pre-med shop in general and helping these folks get prepared, not just for applying to the Thomas F. Frist Junior College of Medicine, but really all medical schools. So this will be fun today. I'm looking forward to it.
Yeah, so why don't you just tell us a little bit about yourself, your background, and sort of how you ended up where you are and that kind of thing.
Yeah, so I started my I originally wanted to be a football coach. I grew up in Texas. Football was a big part of my life growing up, and it still is a big part of my family's life. My brother is a football coach, and I went to Baylor University. I started working as a student worker in a health professions advising office. Next thing I know, I'm back at my alma mater doing health professions advising. Then I moved to Austin and did a little bit of advising at University of Texas at Austin, became director of health professions advising at Southern Methodist University in Dallas, SMU, before moving halfway across the country to Philadelphia to do admissions and advising for the Temple University College of Science and Technology post-bac program. And so I really enjoyed my time both doing admissions work and working with non-traditional students through the post-bac program. Then, as you said, this new med school here in Nashville was going to be opening. I was excited for the opportunity to come down and help them build a new institution really from scratch. And so I took on the role of the director of pathway programs and recruitment to start getting students to Frist. So yeah, that's kind of my pathway here to Nashville.
Okay. So I guess coaching and advising pretty similar. Same concept, right?
I tell my students all the time, I can tell you where to stand in the end zone. I can tell you where the ball's going to be, but you still have to catch it. So yeah, it's just like being a pre-med student. Yep.
So, as we mentioned, this is a brand new medical school. So just tell us a little bit about Frist and, how it came to be and where you guys are and all that.
Yeah. So we are the third med school here in Nashville. If you're not already aware, we have Meharry, we have Vanderbilt, two very well-known, well-established med schools. They've been around for a long time. We are the first med school in Nashville in 147 years. So wow. It's about time we got a new med school here. And really it's to address, the big picture is it's to address the shortage of physicians nationally, not just here in the Southeast, not just in Middle Tennessee, but nationally there is a physician shortage. So really, we started planning for this med school even before I got here over 2 years ago. We received our preliminary accreditation in October of 2023, which is late in the cycle, but we opened up on AMCAS for our inaugural class in November. We closed out our app in February, and we've just finished interviews in April. And so we have really wrapped up at least the process of starting to get our inaugural class seated. That first class will be 50 students. So we're going to start off small. our second class, which we will be on AMCAS May 2nd with every other school, finally kind of to a normal app cycle. And then we will take 50 in that class. And then the plan is to the third cycle to be up to 75, the fourth cycle up to 100. And then as I guess with all of these things, I should say the plan is to, being a new school, things are always subject to change, but the goal is to get to 100 and then kind of sit there with a 100 student class, primarily because we feel like it really allows us to still have a good sized class, contribute to having physicians out there in the world, but also keeps it small enough to where we still know everybody, we know everybody's story and name and background, and that our students won't just feel like a number. So that's kind of where we are now. And it's been a whirlwind since October, but it's been a lot of fun, and it's been really exciting starting to meet all the students as they interview for our new medical school.
So, so I'm just curious, like as a new school, I mean, what's been sort of the reception of, where applications where you thought they would be? I mean, what kind of reception are you getting?
Yeah, so I think throughout this whole process, we try not to have any really preconceived ideas about like how many apps are we going to get? What are their metrics going to look like? I think we all kind of had some ideas in our head of, I think the metrics are the easy part, right? I mean, everybody knows higher MCAT scores, higher GPAs are good things, but, there's a big difference between what's a 4.0 and a 528 and then, everything else. And so we really just wanted to see like what kind of applicants do we get? What do they look like? What are they about? Not just their metrics, but what are they doing? Do they have a service orientation, for example? Do they have clinical experiences? Do they really know their why? And do they know it well? And then also, are they adventurous enough to come to a new school where maybe all the guardrails aren't defined yet? That takes a special kind of student too. And so, it's been really fun kind of seeing all of those things. But right now, we don't have any defined metrics. We have some minimum metrics for admission, but we don't have, and we make those very clear to our applicants. But I will tell you that next year, we're on MSAR now, but if you look in there, everything on MSAR is blank. Next year, all of our data that we have available will be made publicly available. And I'm just as excited to kind of see what our first year class profile looks like, as much as anyone is.
So, so your namesake, Dr. Frist, is a well-known physician and philanthropist there in Nashville. So how did the medical school come to be? I mean, how did that, I'm assuming this was his vision?
Well, this is a joint vision at Belmont University. So it's actually we have a current president, Greg Jones, but it was really started, the seeds were planted with Bob Fisher, the president, before Greg Jones, and he started to plant the seeds. I can't even begin to guess what went on all behind the scenes with these, billionaire philanthropist, physician, flight surgeons, and the presidents of universities. But their dream was realized in having the Frist College of Medicine right here on the Belmont campus. And so in discussions with the community, discussions here in Nashville, discussions with Belmont, and the healthcare system that's connected to here in Nashville, there's just a giant, we have HCA, we have Siloam Health, Heritage Health. There's already a lot of medical related things happening here in Nashville. We fit right into that infrastructure pretty smoothly. So,
and your campus is actually on the Belmont campus, right? So that's another advantage.
Yep. So when we moved into our brand new medical school building literally about 2 weeks ago. And we just moved basically across the street. And so I guess that's another good thing to point out with students that are looking to come here. You won't be in an isolated building as a standalone med school. There's nothing wrong with that, but we think there's benefit in having access to the health services, the counseling services, the dining services, the basketball games, all the things that our Belmont undergrads get, our med school students will get that in addition to the medical training that they'll get here.
Yeah. So, what I know that you're still kind of feeling your way out and all that about, what the future holds, but is there sort of a mission or vision that the medical school sort of encompasses or, holds to?
Yep. So the vision is just shaping medicine through transformative whole person care. And that's really where we start. And I can kind of break down some of that if you want, but I think the real important part of that is that whole person care component. And it really shows up in two ways. One is how we train our students to treat their patients. So a patient isn't just a symptom. They're not just a disease. They're a person. They have feelings, they have thoughts, they have families. And so, when you have to give good news about a diagnosis or even bad news about a diagnosis, you don't just give it to the person. It's a family affair, right? It's a much more broad, all-encompassing whole person thing. And taking into consideration all that is important. The other layer to that is the whole person care that we provide to students that come here. So I can tell you as advisors, one of the things you can rest assured, we're going to take care of your students because they are also not just MCAT scores and GPAs and test taking step scores. They are real people with also feelings and families. And we really want to make sure that not only are we fostering their development as a doctor, that's one thing. You can train somebody to be a doctor. You can teach them science in the process, but also teaching them how to be kind, caring, compassionate care providers and leaders in their field. So that's kind of how that mission is going to be demonstrated, not just in how we train, but also how we treat the people here at the Frist College of Medicine.
So can we talk a little bit? So from our student perspective, if I'm getting ready to apply for AMCAS, this semester, and what's the process that you guys are using to screen applications? Does everybody get a secondary? How do you do that?
Great question. And this is something from the outset that we wanted to be very transparent about from the beginning. So a lot of the things I'll talk about today actually everything I talk about today is not a secret. It's very clear and transparent on our website. And this is something that was near and dear to our assistant dean for admissions, as well as me. Coming from an advising background, I always appreciated the schools that were transparent about these kinds of things. And so secondaries, for example, to be eligible for a secondary, 497 on the MCAT or higher, a 3.0 GPA or higher, and that's cumulative overall AMCAS calculated GPA. If you meet those two metrics, it's not an automatic secondary, but there's a high chance, unless there are other factors that might be counter to that, significantly counter to that, might you not get a secondary. But most everyone that meets those two metrics is going to get a secondary and is going to get an opportunity to tell their story through their personal statement and through the secondary questions. In fact, we're so transparent, we just put our secondary questions on our website because it helps students start to pre-write them, get ready, and also kind of know what we're about. I think you can tell a lot from a school by what they ask you on the secondary questions. And so that also gives students kind of a peek behind the curtain as to what they can expect from us as well. So also, in addition to that screening, a couple of other things I'll point out, just because I know students want to know, that after the screening phase, of course, you fill those out, you turn those in, then the interview phase comes up. We're doing all interviews virtually. We don't see any reason that we'll change that. I think everybody's kind of adapted to that. And I think in the end, it's better and probably more equitable for everyone to just, you don't have to pay for a plane ticket or a hotel room. It's just easier and quicker. But we are supplementing those with second look days, accepted student days. So the students that are accepted will get an invitation to come to campus. We'll have some very specific days and programming provided for them. Because it is virtual, maybe some of the students that haven't been to Nashville before, they want to check out the facilities, they want to meet us. So we're going to provide that too, at a low stakes way, right? They've already been admitted. They don't have to come and feel like there's a lot of pressure on them. So that's kind of what a student applying to our school can expect.
Okay. So in terms of like requirements, prereqs, things like that, the standard for most med schools, do you guys have anything that's special or unique?
No, in fact, they're all, again, published on our website. They're exactly what you would expect. Chem 1 and 2, organic 1 and 2, physics 1 and 2, biochem. And again, we make it very clear, if a student is close to everything and they think they have most of the prereqs met, but they may be missing something or think they're missing something, they can always just email medicine@belmont.edu and ask. That will be reviewed by our admissions team and someone will take a look and get back to them. But we haven't had any issues with that. If you can apply to one medical school, you're likely going to meet the requirements needed for the Frist College of Medicine.
So you guys, so you're private. So are you looking for students from a particular region, or is it nationwide? Are there any kind of preferences that you have in terms of applicants?
So there are a couple of things here. Yeah. So first of all, no preference whether you're from Tennessee, Louisiana, Texas, California, New York, and in fact, I think the first person that we admitted wasn't from Tennessee. So and that's another thing that's going to be really exciting to kind of see what our class profile looks like and where everybody's from and what undergraduate institutions are represented. You do have to be a U.S. citizen or permanent resident. That is one requirement. However, again, the state residency is of no consequence to us, good or bad. And also with that comes, we are a private school, so there is no difference in tuition between
Right.
a private or in-state or out-of-state. Yep.
Yeah. So, you were a pre-health advisor, so you kind of know the types of questions that students have and the things that students fret over and things like that. So now that you're on the admissions side, I just want to kind of, from your perspective, how does an applicant stand out in a list of applicants? So you've advised, you've evaluated, how does somebody stand out?
Yeah. So I'm going to mention a couple of things. I'm going to give some general advice, and then I'll give some advice that I think is more specific to the Frist College of Medicine. And one of those is a tool I think we as advisors have used for a long time. It's the AAMC core competencies. I think a lot of students say, what are medical schools looking for? And it's very clear. The AAMC core competency list outlines exactly what not just the Frist College of Medicine, but all medical schools are really kind of looking for to some degree or the other. We're not saying that you have to do all of those well, that you have to do or even do all of them, but you need to be able to identify which of those are your strong suits. So I would just say that in general is helpful to review in order for applicants to med school just to get prepared and just to start thinking about ways. Even freshmen, look at that list and start developing those out. So there's a few things, and again, these are all on our website if somebody wants to kind of read through these again on our admissions page. But one of the things is dedication of service to others. So we really want to make sure that a student is demonstrating service. Why? Medicine is a service profession. No matter how you slice it, you're seeing patients at their most vulnerable when they need you, and you need to be of service to them, and you at least need to have kind of this service mentality. And so we're looking for students who have already started to cultivate that. We're looking for people who are curious, inquisitive, and solve problems. So one of the things you won't see on a list of things that we are looking for is research. That doesn't mean that research isn't important to us. If you do research and it's something you want, does that demonstrate problem solving? Does that demonstrate curiosity and inquisitiveness? Yes. If you do research, amazing. We want you to embrace that. We want you to be about that. If research is something that you're not really into, that's also okay. There are other ways to demonstrate curiosity and inquisitiveness. Example that I always like to use is something like study abroad. That can demonstrate someone has an inquisitive or curious nature. They want to go check out something else. They're an explorer. We also are about building a diverse culture of inclusion. So this is another thing too. If a student isn't wanting to be part of a very diverse and inclusive atmosphere, this may not be the place for them. So we really want to make sure that we're cultivating that. Also, one of the things that our dean talks about is something that he refers to as the fierce work of medicine. And it's something that I kind of alluded to earlier, but this is really best touched on by students going out and getting clinical experiences, getting exposed to what I call the truth of medicine, knowing that some days medicine is awesome, you're the hero, you save the day, and then other days you have to get home and you may have to look yourself in the mirror with a tear coming down your face, asking yourself, did I do what I needed to do to save this person? Or even if I did, this was a disease or a situation that I couldn't overcome. And now having to deliver that news to a patient or a family too. So it's the pendulum swing between the amazing and the scary and the not so amazing, but you being able to embrace that truth. And then the last thing I'll add, and this is, I think, for every medical school, but really more specifically here at the Frist College of Medicine, is a tolerance for ambiguity, mainly because we're brand new. I think being being tolerant of ambiguity is important for every applicant because you just never know what med school is going to throw at you. But that's amplified with a school where, as I mentioned before, not everything is completely finalized and built out. And for some people, me, I'm one of those people. I moved from Philadelphia to Nashville before our school was accredited. And, I didn't know if that was going to happen. I had a lot of faith that it would happen. I knew the people here were working hard to make that happen. But you do take kind of an adventurous opportunity. And so I think with that fear also comes opportunity to build. And I think we really are looking for students who want to come here and actually help us build a culture, an ethos, an attitude. We can do all the things in place around them to support them, but we want a student with an adventurous spirit and an active contributor to our school.
Yeah, I think that's kind of that's a really unique opportunity for a student to kind of ground floor, building a medical school and kind of being a part of that. So I know that your first class will be getting there in this fall, but just looking out at the curriculum, what you have envisioning, what are there clinical opportunity? What's your plan for how students will receive their training and things like that?
Yeah, so it's three parts. In many ways, it's structured like curriculum at a lot of med schools. It is a systems-based approach. Your first 2 years, give or take a few months, are going to be your basic science coursework. I would say that our students will start to dip into their clerkships and their clinical experiences maybe a little earlier than at some places. Near the second year, they'll start to get introduced to those kinds of things. Then you move into that end of the second year, third year. And this is where you start to get deeper into your clerkships. This is really what I think of kind of like exposure. This is where the football coach in me comes out. I think about you've now made the team and you think you want to play quarterback, but we're going to actually have you try out at every position. And it may confirm that, yes, quarterback is for you. Or you may say, I actually like catching the ball better than I like throwing it. Or I like tackling the people better than I liked playing offense. So, or it may confirm exactly that, like, yes, surgery is for me, pediatrics is for me. But it's an opportunity to get exposed to those things. And then by your fourth year, this is kind of the stage where you really start to hone your skills. And really, this is all in preparation for residency. So this is where you start to get a deeper dive into your clerkships. This is where you really start to test yourself. And then the last month is essentially like a residency prep course. It's a capstone course. And then the goal is to have you, there's a couple of goals. One is students think a lot about step scores and passing those step scores, and that's clearly a goal. But the bigger goal is to prep our students to be able to confidently apply to residency in the area that they want, where they want to get it. That's the goal. So yes, we're new, but we have a lot of experienced people here that know a lot of people, not just in the Nashville community, but nationally, that can help you build out that network to help you achieve those goals. So that's the plan.
Yeah.
And we're really excited about just, it's crazy to think about year 3 and 4 right now when we haven't even taken our first class, but it's coming. It's going to be amazing.
But you mentioned like Nashville, there's so many opportunities there and so much of the healthcare industry opportunities in that, in your area. So that's a great opportunity for students to kind of get that exposure in all these different types of medical settings. So I'm going to just, what is your number one piece of advice or the most important thing you would tell somebody who's like at our student level where they're investigating medical schools, they're getting ready to start applying? What's your big advice?
Yeah, I'll give 2 pieces of advice. The first is really dig into that clinical and medical exposure. And a lot of times people do that with the attitude of, I'm doing this to prep for my application to med school. I want to look good on a med school app. But really what you're doing is you're doing clinical experiences for you as an applicant, because you're testing yourself to find out, is this really the profession for me? Because I would much rather find out that I don't really like being around sick people and don't really like being around patients, and I don't like the truth of medicine as a sophomore or freshman or junior in college, as opposed to a third-year medical student when you start your clerkships.
Right.
So really use that clinical experience as an opportunity to strengthen your application, but really strengthen your why. And it's also going to provide you with some excellent stories for your interview day and your personal statement. And then the last thing I'll say as a point of advice is be yourself. We want to embrace the whole person. We want to embrace who you are. I had one of my mentors and someone that I worked with who was worked as an admissions dean at San Antonio Medical School, Dr. David Jones. He would say, if it's of value to you, it's of value to us. And I think we feel the same way. If you find something to be valuable as an applicant, that could be a hobby, that could be an interest, that could be just something that makes you who you are. Be yourself, embrace it, and we will embrace you too here at the Frist College of Medicine if that's something that you do. And that doesn't necessarily have to be something sciencey or nerdy or medically related. We want you to just be who you are in addition to those things. So prepare clinically, be yourself, be who you are, and just keep trucking along. That's the best advice I think I can give.
So I want to kind of change my last little question here, but so when you've been going out and talking to students and talking about your school, what's your message to people? Why Frist? Why do you think that this is a school that someone should consider?
Yeah, I mentioned one of them earlier. Med school is difficult. It's hard, and that's not going to change. Our goal isn't to make med school and the curriculum and the material easier for a student. That's not the goal. I think you're missing the point if you think that's the goal. The goal, though, is to give you a support structure and people around you that can help you navigate that difficult process, maybe in an easier way. So I would say that I know that our Office of Student Affairs and Diversity here at the Frist College of Medicine has some incredible people from some other incredible institutions that have moved here with this same goal and vision to support and take care of students as they navigate this journey. And I would say that that's something that, yes, that may exist at other medical schools, but I feel like that's something that we do really well and are going to support our students in ways that I think are going to be very impressive. So yes, you can learn how to be a doctor, you can learn a procedure, you can learn the science, but are you going to be doing it in an environment that supports who you are and supports that journey toward really truly being a caring and compassionate person and not burned out already on medicine by the time you get to see patients, which is what we see and have seen in the past with a lot of other medical schools. And so I'm not saying you won't be tired when you're done, but hopefully you'll leave still with a kind, caring, and compassionate outlook on the patients you're about to see. So I think that's what a student, if what I just said sounds attractive to a student, then they may be a good fit for the Frist College of Medicine.
Yeah. So just kind of finishing up on, your title is Director of Pathway Programs and Recruitment. So can you talk a little bit about the pathway programs and how that is involved in what you do?
Yeah, so I think that for me personally in my job and my career growth, that's the next big area of growth for me. As I mentioned before, we're still trying to kind of launch this ship and get it seaworthy. I think in order to create a pathway, you first have to have a strong destination. And I think that's the next phase. We have some things in the works with some programs that we're working with to try to create some very direct pathways, and we'll be ready to make those announcements very soon. But right now, we're focusing on internal pathways here between Belmont and the med school, which I think makes sense. And then also a couple of external pathways as well that we would like to grow that are here kind of locally in Nashville. And then once that happens, of course, I think we'll have all kinds of things like summer programming. We're even going to have some opportunities for students to come visit our campus. We're going to have opportunities for advisors. So heads up, y'all, you're going to get some invites at some point to come visit campus, which will also have kind of sort of mini advisor conferences. So there's a lot of kind of things that are currently being built out that will grow really once we get students here. It's also difficult to provide mentorship to young prospective students through a pathway program if we don't have current students yet.
Right. Yeah.
That's another opportunity for current students to get here and then also be active participants in mentoring our pathway students and other undergraduate students. So maybe if you come back and do a talk like this in the future, I have a med school student with me who can speak more specifically to the experiences of the med school. So that's kind of where I see that pathway component.
So if somebody's like a high school student who's watching this or whatever, I mean, they can certainly kind of follow your progress and as you start rolling out and introducing types of programs like this.
Exactly. You're exactly right.
Okay, so Matt, do you have any questions?
Well, I just want to. I saw you guys are on the preview list, and obviously it's a new test and everything. We did our own episode just on what that is. But why don't you guys share how you think about a preview score within a whole application portfolio?
Yeah. So when we use holistic review here, and we use it in the truest sense of the word. I know a lot of people throw around holistic review as kind of a buzzword, but it's truly something that's very, very important to us. I don't think you can preach whole person anything without doing holistic review, correct? And so preview is just one of the slices of the pie in this big thing of your metrics, attributes, and experiences. And so is it more or less important than an MCAT score or a GPA? No. Is it more important than a personal statement or an interview or anything else? No. Can it give you some initial insight into what you think an applicant might be like? Sure. Of course, you need an interview to confirm that. So, if you think about tons of different data points, just like an athlete isn't just their 40 time, a student isn't just a single number. There's a lot of other things that they have to do well in order to get there. And preview is just another metric to use in evaluating a student. Can a preview make or break a candidate? I'm sure if the score is poor enough, sure. Just like an MCAT score could sink an applicant, but it's still taken as just a part of the whole.
Yeah, great. No, thanks for sharing. We're really excited, especially not being, too far from you here, and definitely excited to have you on. And we'll obviously be keeping our students updated with what's happening with you guys. But congrats again on launching the first class, and thanks again for joining us today.
Thank you. It's awesome being here. Appreciate it, and I appreciate the opportunity. Thank you, guys.